All right, let's talk about claustrophobia. This is a very common one. A lot of people suffer from it. There is obviously a very wide spectrum. For some people, it's very, very mild, all the way to I cannot fly, I cannot be in a car, I cannot be in a building. Usually, it's going to go all the way back to the birth process. If my birth was a very difficult one, and my body was trying to get out of the womb, but something was off. I was not very well aligned, or something happened that created that sense of being trapped. More likely, later in life, if I get an experience that mimics that one, my body, my subconscious mind is going to start to activate that response. So just because you or somebody you know had a difficult birth doesn't mean that they are automatically going to be claustrophobic. But if they have another experience like that, in which, like, let's say they had some kind of car accident and they were trapped for 5 minutes or 10 minutes or an hour, XY, that might trigger, that might turn the program on, because the body had already experienced some kind of trauma, which they were trapped. Now, for biomagnetic therapy, often points will include this area here, the occipital lobe, the radicular bulb, and then somewhere in here. So I guess the most common one will be like black side down on this area, and red side in this area. And I would assume that it's because of the birth process. This is a very difficult area. This is where the shoulders often have trouble coming out of, and the baby has to do the twist, the flipping. Flipping, I don't know how to say that, but anyway, this is where the baby kind of shifts and has to turn. And I'm just thinking out loud, right? But this area often comes up in claustrophobia. So if you suffer from it, or you know somebody that does, just start by placing black side down on this area right here, and a red side in this area here. It could be here, both. You can even do a double pull on each part, on each point. And obviously, again, that is just one possibility out of many, but it's one that comes up a lot. Ideally, you want to do the scan, the full scan, find out all the emotions linked to it, all the EBPs, SBPs, and obviously find the biomagnetic code to successfully decode it. But at least you can begin with black and red. All right, let's move on to the next video. Bye-bye.